here's what you're looking for. You have the patient open as wide as they can, comfortably, not to overstretch. You've got this little gizmo. Has everybody got one of these or close to it? Okay. So you're going to put that in their mouth, say open real wide. You put that little hook on their lower front teeth. Okay. So you can open, say, 40 millimeters. Okay. Now you're going to ask them, okay, take your tongue, tip of your tongue, and put it behind your upper front teeth on that most front part of the little tissue projection, the papillae. Okay? Behind your upper front teeth, feel your gum with your tongue. Okay, feel that groove between the tooth and the gum itself. You want to be right on that groove. Okay? So now, put your tongue on the groove and open as wide as you can without lifting your tongue off of there. Okay? Now measure that. Take that number and divide it by your maximum opening. And what he found in doing a retroactive study on all this stuff is that if you could open 80% or better, you probably didn't have too much of a problem. There's about 10% of the people he studied. If it was 50 to 80, you might have a problem. If it was less than 50, you definitely probably had a problem. And if it was less than 25, you had a severe problem. And that's when you would do this. But he doesn't ever do the surgery without the patients having myofunctional therapy first, because he says it makes his surgery less invasive. He can see the muscles better, and the patients have already done a lot of stretching exercises and things like that to help minimize the amount of surgery he has to do. Do y'all understand what I'm talking about when I'm trying to explain this opening and the position? I'm sorry? Well, you take the second measurement and divide it by the measurement of the maximum opening, that first measurement, okay? So you're going to get a percentage of the smaller opening, okay? And he calls that the tongue range of motion ratio, okay? So here's the difference in all these things. The frenectomy is you just cut the frenum, basically. A frenectomy, you're basically cutting the ligament itself, the covering, and taking that out of there. A frenuloplasty, you cut it and take it out, but then you're going back and separating that fascial band and covering. And I did a patient last week that is a PA for a physician friend of mine, alternate physician. And her whole life, she said she felt like she couldn't breathe, but no physician ever considered doing anything because he said, you know, everything's normal, but I can't breathe. And she had rounded shoulders, forward head posture, young woman, about 35 years old. And when we started the procedure and made the first couple of snips in there, she said her neck started popping as we were doing it. Everything was starting to release in there. And all this just calmed down. And she said, my God, I can breathe. I can breathe. And so that's what this can do for people. But the revision frenuloplasties, some of these people, it's like this, the very last one, stage frenuloplasty. I've got a number of patients that I'm going to have to do more than one release on. One of the patients you'll see here in a second in a video, she had the worst frenulum I've ever seen, tongue tie. I went in to introduce myself. She's a new patient. I'm Dr. Sprinkle. What's your name? Hi, Dr. Sprinkle. I'm Sharon. And I'm going, oh my God, you can't even get the tip of your tongue above your front teeth. She's there just for a dental checkup. And I asked her, do you ever have trouble breathing? So, oh, Dr. Sprinkle, I always had trouble breathing. How about your speech? Oh, I'm in speech therapy my whole life. She's 60-something years. I was diagnosed that I had cerebral palsy, but I didn't have cerebral palsy. You know, but I had worked forever to get my speech right. Well, she couldn't get the tip of her tongue above her front teeth. So, and again, the purpose of the surgery is to help improve the myofunctional therapy. Now, this is a study that Dr. Zaghi was one of the co-authors of, and it was a review of the literature, a meta-analysis of myofunctional therapy in comparison to other techniques for treating sleep apnea and snoring. And what he found is that myofunctional therapy in adults, they could lower the AHI, the apnea-hypopnea index, by as much as 50% in adults and 62% in children, without having to wear appliances and without having to have a CPAP. So a lot of times, hopefully, the myofunctional therapy will prevent them from, not even having to have the surgery. That's our goal. Okay? And these are some of the common signs. The snoring and sleep apnea, obviously, head and neck, facial pain, migraines. I did an elderly physician 2 weeks ago with a 50-year history of chronic migraines and headaches, elevated blood pressure and pulse rate. She woke up the next morning. She didn't have a headache for the first time in years. Her blood pressure was normal, and her pulse rate was normal. And she said that hadn't happened since she was a young girl. And since that time, she's taken one blood pressure medication and had one headache when we had a storm move through and the barometric pressure changed. TMJ, bedwetting. Bedwetting is a sign of an airway problem. Nightmares, night terrors, walking in your sleep, talking in your sleep. Those are all issues. Because what happens when you're asleep and your airway starts to close, your autonomics, the story I tell myself, and I'm waiting for Dr. Berger to change my story, but your autonomics senses that as a threat. So you get a jolt of adrenaline, okay? And so now you've got to do something. Your heart rate goes up. You may wet the bed. You may start mumbling, having, as my wife did, these nightmares and night terrors. All those things are signs and symptoms of an airway problem. I had a little boy, 5 years old. Daddy brought him in to see if he had a tongue tie. I said, this kid takes all day to eat. He can't chew his food. And that half the time he spits it out. Sure enough, he had a really bad tongue tie. I did the tongue release. I called that night to check on him. He's outside playing with his brothers and sisters, riding his bicycle. Well, how's he doing? I said, oh my God, you should have seen him at dinner. He looked like a wolf chasing a pork chop. I mean, it's unbelievable how fast he is. He said, I swear I think he's taller. And I wouldn't doubt it, So stuttering, trichotillomania, cuts themselves, chronic sinus and ear problems, crooked teeth, tori, all these things you can see here. Worn dentition. I know a lot of your physicians and not dentists or naturopaths or chiropractors. Ask your patients to look in their mouth. Have they worn their teeth down flat? Do they have broken teeth or broken fillings? That's from clenching and grinding. And all of that at night, you're trying to maintain your airway. You're clenching to try and create some muscle tone back here to help open your airway. So here's the little lady with cerebral palsy.
Okay, this morning I have Sharon who has a very severe tongue tie, and I'd like for her to tell a little bit about her history of chronic pain, postural issues, swallowing, airway, sleep, any kind of chronic pain issues that she's had over the years.
Mm-hmm. I've had
Watch your eyes.
Shoulder and neck tension, pretty prevalent. I've had difficulty swallowing. Excuse me. Also, I've had difficulty speaking. That's something I worked very hard over the years to pronunciate as well as I can. Let's see. I also clench my jaws at night. I sleep with my mouth open. Wake up with my mouth very dry. And hoping that this procedure will alleviate some of these issues.
Okay. Anything you have?
This is right after.
Okay. This is the straightest I've stood in my entire life.
Look at her eyes.
Oh my gosh.
Well, and when you speak, I can actually see your tongue move. It's
Yes.
coming above your teeth.
Right?
You may still not have a 10 out of 10 perfect tongue position, but
Right.
it's at least
It's much better.
3 or 4 times better than
Yes.
it was. I
Yes.
mean, you can literally get it up behind your upper front teeth.
I can.
Yeah,
Yeah.
yeah. And your posture is greatly improved. That's just so exciting.
Oh my gosh, looking at it. My shoulders are back. Yes, I'm breathing better.
Okay.
Yay.
Well, I can't wait to see how you sleep, find out how your sleep is.
Oh my
Okay?
gosh. Thank you.
Thank you.
This is a gentleman, another new patient that came in for a dental exam as a new patient. And for whatever reason, I didn't take a before picture or video, but he has an interesting story.
This is my patient Bill. He's back for his post-op. We did a frenuloplasty on him last week, and I'm just going to let him tell his story of his history and what he feels like this has done for him in just a week's time. Go ahead, Bill.
Well, I can tell you, I've been to numerous doctors, lung specialists, ear, nose, and throat, some different lung specialists. I've had MRIs. I've had CAT scans of my lungs. Everything showed negative, nothing wrong with my breathing. Some doctors say was in my head. Some doctors say I have panic attacks. I've had doctors give me prescriptions of Xanax and said that would help me because I'm obviously having a panic attack. Well, let me tell you something. When you can't breathe, you will have a panic attack. So, like I said, after I had this done, couldn't tell much in the first few minutes, but the next morning when I go to do my regular chores, feeding the horses, feeding all the animals in the pasture, walking all the way back to the house, I was out of breath, but I was able to catch my breath the first time in years. I usually have to sit down, take a breather for 30 minutes to be able to catch a breath. I can catch a breath within 2 to 3 breaths. I caught a full breath. And right after I did it, I was no longer dizzy. I was more alert. I was not incoherent. Nothing was fuzzy. I could think better. I can actually sleep better. I don't sleep with my mouth open. I can actually breathe through my nose. I actually almost feel air coming through the back of my throat, which my chest is no longer tight. Can you imagine sleeping and feeling somebody sitting on your chest? Well, you don't notice it during the day, but when you're trying to sleep, it makes a big difference. The only thing I can say is this procedure done what nobody else could do. I even went to ear, nose, and throat. You would think that they would have caught that, but no. I actually didn't come in here for breathing problems. I came in here for dental work, which is ironic. And now we've solved something else, which is great.
I'm running short of time, but here's the little lady whose neck popped last week.
Okay, this morning I have Danielle in the chair, and I'm going to ask her to
why it's so small,
give a history of her symptoms and what she hopes that we can hopefully achieve today for her when we do her frenuloplasty. Go ahead, Danielle.
Okay, so a little history about me. When I was an infant, I nursed every 2 hours for 2 years. I never could evidently get enough milk. I don't know, but the doctor never really examined me or anything. And then about the time when I was 9, I started getting kind of complaining of neck and shoulder pain to my mom just constantly. And through the years, that just kind of got worse. So bad now that I can't turn my head too far one way or another. I start getting dizzy. I've had to get a special pillow to help prop my neck up so that I don't wake up with horrible migraines. So those are some of the major symptoms that I've been having, but mostly tension and constriction here, decreased mobility, and just chronic pain. I'm constantly at a 6 or 7 with my pain. I'm trying to think what else.
What are you right now?
A 7.
Okay.
Yeah. Yep. So I'm hoping that this procedure will help relieve some of that and give me my mobility. I can't do frontal hugs with my husband. It sounds silly, but if he comes and hugs me, I cannot put my neck back without having really bad pain. It's very painful. So excited to see what happens.
All right. Thank you. Okay, we just finished Danielle's frenuloplasty, and I'm going to have her describe to you what she's feeling and what she felt during the procedure.
Yes, during the procedure, I could feel my jaw relax, and then it kind of just worked its way down. I had a couple bones pop during the procedure, and then I was able to breathe. I can breathe freely now. I don't feel like I'm being pulled forward. I can put my shoulders back, which is really amazing because my husband would always be like, put your shoulders back, you have poor posture, and I'd tell him I can't. And now I can say I can. And I feel like my neck is longer, like I can be upright, and just the ability to be able to breathe, that feeling that I can take a deep breath, And my pain is, that tightness that I was feeling has probably gone down to about a 3. So, very excited.
Wonderful, wonderful. Well, let's see how you can turn your head.
Yes. I have never, ever been able to do that.
Wow. Let me get you to stand up for me
Okay.
real quick. You ever been able to touch your toes?
Yeah, but that's about as far as I can go.
Okay. How about rotation, twisting right or left? Wow.
Yeah, I haven't been able to do that without getting dizzy, and I'm not dizzy.